I am so excited to introduce you today to Esther Onyoni. She is a clinical pharmacist, a health and wellness coach, and we have a lot to learn from Esther today. Welcome.
Thank you, Lindsay.
I think that one of the best and easiest spots to bring our listeners into this topic today is we need your background. We need your personal story. So you take the floor.
Thank you. That's great. Yes, as you started, yes, I am a pharmacist. I have practiced for the last 15 years. And the reason I'm in this place where I've seen how I've taken care of patients who are mostly tackling chronic conditions. That's where I help my patients and seeing how they have needed someone to help them know the things to ask their providers, because when they come in, they have lots and lots of medications. I specialize in diabetes, and the reason I do that is in my 15 years of practice, I have observed these individuals come in with a medication because their numbers at the provider's office were high, they get a prescription, and then the next visit, they have more medications added on to their profile. And it gets you to a point where you wonder, how can you help them hit the reset button? Because it doesn't quite stop there. It goes on to other things coming up. Maybe they're struggling with their stress or sleep or whatever it is that's come up, or pain. Definitely, that sounds like more medication in their profile. And so, having observed that as a pharmacist, I looked at it and I thought there's got to be something more. So, but for a while, I just observed and I did not like that place. So this is where my story comes in, where I actually grew up as a person who I went to boarding school. And so I grew up as a person who was told, you're here to be seen and not to be heard. So I didn't grow up as a person who always stood up to speak for myself or even speak for anybody else. And when this is something that doesn't just stop as you grow up, I learned to just hide in plain sight. I did not always want to show my face because it's one of those, you just here to be seen, not to be heard. And what I say, mostly, I didn't think it mattered. But growing up with that, you get to a point where you feel that you're really not being heard. And clearly you're not being heard because you're not speaking up. And that's kind of something you grew up with. And so I sought to just let this behavior go because it was not serving me. My heart was saying, you got to speak up and you got to say something. And yeah, that's how it happened. Every time I went to serve my patients, I said, I got to say something to them, like, let's hit the reset button. But then when I come back home, I'm that person who doesn't speak up. And, there was no balance here. So something was off balance, and I had to seek a way to get to a point where I could listen to my heart. And so one way I did that was surround myself with some women who actually were dealing with something and looking to actually go with what their soul wanted them to speak up about. And that's how I came around to taking care of individuals with diabetes, because I saw that, yes, if I can speak up, because I had gotten to a point where I created boundaries, because that's what was missing in my life, I could create boundaries and speak up for myself. Now I saw how that reflected on my patients, because as they are in their provider's office, most of the time, the provider is the authority, and there's that boundary where you're not going to ask something, maybe because you've learned not to ask, maybe you think they're offended. And so I had to find a way to help them see that this is how you can speak up for yourself.
Oh, this is so good. And there's so many onion layers that I want to peel back with you. Let's even just rewind to when you started doing some of that internal work for yourself. on speaking up. And you said that you were surrounding yourself by other women who were seeking to promote a cause or stand up for their cause. Were you in a coaching program? And is that kind of what led you into a passion to coach? What did that look like?
It was a coaching program, but it's actually two things. One of them, yes, was a coaching program, but the other one was I went into the Landmark Forum, and this is where they help you see how you're being in the world. Why are you presenting the way you're presenting? Because I had gotten to a point where I was wondering, why do I just not? I know there's something in my heart I need to say, but why do I not have that motivation to say it? Why do I let everything else around me get in the way of me speaking up? And, just being in that forum helped me see how I'm being. And basically, nobody took my voice. That is my past. And I'm here. And it also helped me see that we're really in this world to speak up. And that's why I wasn't happy quiet. So you kind of following your passion. And if you're not following that passion, you're not happy. Your body is, or your heart is always saying you need to do something. Even if you try to resist, you can only resist so much. You end up being unhappy.
And so to sit by and you're watching these patients come in with chronic diseases, and you feel like you could be helping so much more is kind of what I'm understanding from you, but you're following kind of regular protocol of bringing them in, sending them out. Am I understanding this right? So how did the passion get built around, I feel like you probably saw a bunch of different disease states. How did the passion get built around diabetes?
Oh, yes. So definitely, yes. So it's around multiple chronic conditions. It didn't stop at diabetes. People who had been diagnosed with high blood pressure, hypertension, the regular conventional way of treating or taking care of individuals with diabetes, it's basically how we were trained, actually, which is go with the guidelines. Guidelines says you start with whatever medication, and then if it doesn't give the control, add on another medication, see what else you can add. And that's the way we managed high blood pressure. That's how we manage diabetes, multiple other chronic conditions, autoimmune conditions. If somebody comes in, rheumatoid arthritis, it's add a medication until you get control of that symptom that they are presenting with. And so that's how we went around with it. What got me was when obviously I'm dispensing medication, and I see that every other medication is something to help bring diabetes under control. And it dawned on me, and this is insane, because why is it that almost every other medication is a diabetes medication? And when I see these individuals, I've seen them multiple times, clearly just about every month, and they have not, their condition hasn't gotten better. And I just remember that it reminded me that in training, we were not trained to say, okay, now you got better, you can get off the medication. This is actually something you're just living with and getting by with medication. And that's why I thought, okay, so that's kind of hopeless, as in, yes, medicine is a tool and we should not count it out, because you definitely need it, but it should not be the end all and be all, because we're looking at a chronic condition where the reason you're here is maybe a lifestyle that was chosen, or maybe saying, okay, I have that in my genes, but in this current world, you can't just say you have it in your genes, because people have gotten to a point where they can hack their genes. So how else can we look at it? And that's how I came around it, to specialize in, okay, I know I have more to offer individuals with diabetes, because I saw more of that, actually.
Mm.
Yes.
Interesting. Okay. And I also want to take this moment to kind of highlight for our listeners, and you and I have this conversation around when multiple medications start coming into play. Do you start seeing side effects start to affect each other? So they can talk on how you feel about multiple medications all happening at the same time.
Oh, definitely. Yes, the side effects are most of the time inevitable, I would say. They do, some medications will interact, especially if someone's taking two different, let's say, medications for diabetes. They can reduce your blood sugar too low until it's not where it should. It's too low that it's affecting you to the point where you're hypoglycemic, you're passing out, all of that. So definitely side effects are inevitable. But what happens is when you see multiple medications, the way pharmacists have, or even the way most insurance companies see it is they say, okay, let's review your medication chart and see which medications can be combined. They don't even say, let's get you off of some of these medications. They say, let's see which medications we can combine so that we're reducing the medication burden in that way. But you see, it doesn't leave someone feeling as though there is this hope that they'll ever get off any medication or that their condition will ever be under control. It's more of let's combine the medication so that if we need to add another one, there is room, So that's more of what I see. And it's gotten to a point where it doesn't sit well with me, considering if you look at the guidelines, the amount of time that's left or space that's left for seeing a person as an individual to see what they really need. Because yes, the medication will work, but there's some people who the medication does not work for them and they end up with side effects. And then what? Yes, there is options, but there's also expenses involved, side effects involved. Maybe they're injecting, everything that's involved. And I don't see a place in there where we ask the individual, as in, how is this working for you? Or what could you do to help you, this work for you better? It's mostly you're left on your own, and whatever happens because the guidelines say so. So
yeah, well, and it's scary. And I feel like you've seen this too. Like when I was dietitian in a hospital setting, you don't get a ton of time with people. And I'm sure, and I want to talk to you about this want of going into coaching too, loving the ability to keep seeing clients and patients on more of a regular basis and like having that opportunity. Because when people make changes, as you know, they don't happen at once. Like we need to get them over time so that it feels tangible, doable, attainable. So before we leave that, and then I do want to hear about your coaching and how you have shifted a little in this area. We had a physician at our hospital who took the time, because we were in an outpatient clinic, and would take people's medication lists. And sometimes if they had 15 medications on it, would kind of work his way down the list and go and question it, not necessarily remove it right away, but question it. So I just want our listeners to kind of hear this as we go. Do you find this in your line too, that sometimes people have just been living off this medication list for so long that they haven't even questioned it in years to even reassess where they are?
Totally. Oh, that is very common, especially if someone has been released from the hospital in case they were admitted. The medications they were released with, they continue taking it. If they don't have some, and it's common in maybe elderly individuals who, if nobody went back to look on their medication list, they will be on something for a long time. But I also see that commonly because you would ask somebody, especially if they are looking for a refill, what do you need to refill? And they say, well, just whatever the spelling is. And you get triggered to ask, what are you using this for? And most of the time you would hear something in the line of, I don't know. And so it's possible it happens a lot but most commonly when someone has been released from the hospital, or even when they switch their providers. If they have a provider who's retired, whatever happened, and they change practices, that can happen also. And usually I'm tasked to call around and see why is someone taking two similar medications. So I could see that question mark you're talking about with that provider who was putting it there. We have such happen a lot. In my situation, it's kind of difficult to get in touch with all those providers. It's kind of a game, because you have to tell the client or the patient that you probably don't need this medication. I see us go through that conversation of, but I've taken this for years. But it's also similar to the other thing you're taking. So maybe you really don't need it. Can we look at that? And so a lot of conversation with the patient or the individual, but getting to the provider, you just have to tell them that, especially just giving them that education that you don't need it, so we need to get your provider. And in a way, that's when I go around to coaching clients, I help them be in charge of their health. And that's one way where you're your own advocate for your own health, because if you're not, there is so much that goes on that the provider does not know. And by the time you get around to seeing them, maybe you have just been playing a waiting game because maybe you've been experiencing a side effect, whatever it is you're experiencing, pain, side effect, or your blood sugar numbers are not under control. What happens is you gotta wait. And if you're in charge of your own health, guess what? Maybe you could actually keep record of your numbers, see why they're going up or down at whatever time and why you're feeling the way you're feeling at that time. And even help them see that if you feel like you don't know what to ask your provider, this is a checklist. When you go in, do not feel like you're powerless. You can ask these questions, just be ready for the visit, and that helps you gain much more out of your doctor's or provider's visits. Provide them with checklists of how you're going to feel when your numbers are high or low when it comes to your blood sugar. The thing about it is these days we have the continuous blood glucose monitors, and that's just such an exciting technology because it helps individuals just know that they're just going to track themselves being in range, a range of whatever they set to their meters. And that way, if it's too high or too low, they know it's coming. They look at the trend. They know what they did to cause them to be there, or they know, and then they know what to do to avoid it. So it's like the technology is working along to help provide this control, or people being just in charge of their condition and not have to feel powerless about it.
Yes, I love that you're stating be your own advocate and then use our resources. We do have really cool tools right now that you can. I even feel like I know that Apple Watches and our watches don't track blood sugar numbers or glucose, but they do give us that ability to show our doctors how we're sleeping, how we are moving, so that we can get this nice full picture of all of it. And then the more information we get down, I think that people don't realize you can walk in, with all of your facts, and your pharmacist, your doctor would love it. Like, you're not going to annoy them. They're going to love it. The more information, the better, right?
Totally. Yes. So yeah, because and then they're more inclined to follow through and know what to do. You actually give them guidance on how they're going to help you. It's easier than them coming from this rabbit hole. They don't know why your numbers have been so high the entire time. At least if you have this, they'll see, okay, the numbers actually stayed high, maybe after lunch, maybe whatever happened, maybe after a workout. And then they'll know what to tell you from there. Yeah.
If a patient brought in like a perfect amount of data for you, what would that look like? A food log, movement, numbers? What would you hope would come in that could really help your job?
Okay, so in my coaching world, when they bring that information, we also talk about how they feel. They got to listen to their body as well. So when they bring that, I'm sure part of it will also be how they felt. And I'm sure for them, they'll just say, oh, I feel great. And that will be reflected in the numbers for sure. And the other thing they'll say is, okay, I know not to either do that kind of workout or physical activity because, as we know, some forms of activity raise the blood sugar while others can keep it lower. So, instead of somebody saying, I'm scared of going to the gym because my numbers will dip, they know actually which exercise to take on. And that way they are actually moving versus saying they can't do it. So it takes away the challenge out of the way and creates way for someone to progress and just do better for themselves. So it's just a lot of power that you have when you have all that data in your hands, and just knowing what you're doing, it definitely progresses you forward because you see, what to do, what you just need to leave behind and carry on.
Okay, I think we need to backtrack for a minute too, because I feel like there's this missing component. You started as pharmacist. You have now a coaching business. Do you do both? And do you do both together or separate? Do you still work somewhere as pharmacist and then have coaching, or have you combined them both?
Actually, I do both. I do both because pharmacy is still my passion. You see, when I just growing up, I saw a lot of individuals who were sick from acute conditions. I grew up in Kenya. So people had malaria, it's endemic over there. And when I was affected, going to the hospital, I saw that there was a shortage of either medication. I mean, it's a third world country. Anything could be a shortage there. And every time I went there, there was that group of people who were struggling and they could not be seen because maybe there's no medication or shortage of healthcare providers. But then every time I went to the pharmacy, I saw that you just described your symptoms to the pharmacist, and they brought back a remedy, something you could use to relieve your symptoms. At that time, I just fell in love with the fact that you actually are an available provider who provides a solution to someone who needs it at that time. So I know it's something that just growing up there, I didn't think I would be able to do because it needed, it was an expensive profession, just going to school for it. It felt as though a bit of hopelessness because, well, we're not going to afford that. But then there was an opportunity for me to come to the United States. And this is just the land of opportunity. It just opens up that opportunity. So as I got here and was able to go to pharmacy school, I fell in love more with the profession. So I see how it serves individuals. I'm very available to patients, to individuals, to provide the solution for them, because who doesn't need that solution quickly? And so the part of it that takes me back is the practice of caring for people who are struggling with chronic conditions. And that's why I want to see that there is a full coverage for them, definitely, because yes, they're going to start with medication, but then they also need to learn about their lifestyle, because that's what's going to help them manage this condition. And then from there, obviously, if they put in place all these lifestyle habits, what happens is the doctor will get them off the medication. And that's just how it's supposed to be. It's not supposed to be that once you're diagnosed, then it's medication and that's your destiny. It does not have to be.
Mm-hmm. Which is so hopeful. And I just think that individuals need to hear that. We are talking a little more specific on diabetes today, so I'm going to stay on this topic. But you had mentioned with us previously talking off mic here that tell us about your belief that there could be even some reversal of diabetes with the right, life plan and health.
It's actually something I have grown to see from several individuals. If someone who has been diagnosed has the intention, they can have it under control. Because in the coaching world, I saw what I did not learn in pharmacy school, which is our guidelines that we trained to use in pharmacy school. They provide you the guideline of how to use medication, and that's beautiful. Medication help. However, they mention lifestyle, but to a very, very minimal space. So when I dove into the lifestyle habits of individuals, I saw that that's just where the source is, because if you dive into their lifestyle, then you're most likely not going to have individuals who are being hopeless in the fact that all they are going to take is medication. So, that's why I do more of the lifestyle for them, and that I combine it with pharmacy. But
and so we're talking more type 2 but diabetes, correct?
Yes. And so the reversing part, okay, get back to the question. So type 2 diabetes is what is reversible, not type 1. But what I saw is that a lot of individuals got into getting or being diagnosed with type 2. So it's not like they woke up one day and the doctor said you have the diagnosis, and they say, oh my goodness, I didn't see that coming. For the most part, you kind of see it coming because the doctor or the provider will tell you have prediabetes. It's something that takes about 5-10 years to progress to diabetes. And so if it progresses, then it can regress. So kind of like there is actually a popular person, the current mayor of New York, who reversed his diabetes. It's just a fun story to hear, but it's about being intentional and just not being hopeless. First of all, what are you going to do? You just need to learn, how did you get here? Because by the time you're diagnosed, you're probably feeling a little burned out. You don't want to take care of yourself. But just learning how you got here will help you reverse that condition. So some people say that they have diabetes in their family or in their genes, but it's there. It doesn't have to be triggered. We don't want to let it be triggered by the environment that we live in. And that's why we need to be intentional with the lifestyle, the environment we live in. And that way we don't have the diagnosis. And if we do, we actually have a way to reverse it, which is, again, being aware of our environment. And by environment, it's literally the lifestyle we're living, which clearly it's, I can compare being in the US and being in Kenya. I remember when I visited Kenya after being here for a few years, and I had arrived at the airport at around 8 a.m, and as we drove away from the airport, everybody's walking. And in my head, I thought, where are they going? Is there something they're running to? But then it dawned on me, never mind. I'm not in America. People walk to get to where they need to be. They're actually going to work or whatever else they need to do for the day. And I saw that difference so quickly. It's a different lifestyle. There is a lot of, you're in a car, you convenience everywhere. in the US. So the lifestyle is, okay, you can drive yourself to wherever you need to be. So physical activity has to be intentional. It's the one thing that when I talk to my clients, they'll start with saying, "Oh yeah, I could eat better. Oh yeah, I could work out more, or I could do more of this." And that tells you right there, yeah, that's the lifestyle that needs to be changed. The support they need is to just, people are not quite always accountable to themselves, because if you tell yourself, "I'm going to do it," you really put it off so many times. But if you tell it to somebody else that you're going to do it, you actually don't want to let them down. So you step up and do it. And that's why if they say it out loud, or they get in touch with someone who's a coach or someone in the family, they say it out that they're going to do whatever they have been putting off. They actually are accountable and they end up doing it. And so in my coaching, we start from there, where individuals will say, "I could eat better, or I could work out better. So what can you do?" And you let them lead the way, because they actually know what they could do. And there they end up doing it. I know a client who told me, "Okay, I could eat better. I love to cook," but they would never cook. Every time we met, they didn't cook. And I said, "So what's getting in the way? You love cooking, and you know the healthy foods to cook. You have your menu that you showed me." And come to find out that it's not just that, there is more to it. She lived in a household with her grown children and grandchildren. She lived in the house with her brother-in-law, and it's too many people in the house. So she felt like she was not in control of her kitchen. And so every time she was ordering at the drive-thru or buying food to be delivered into the house. So that's why my coaching goes more into not just what are you going to eat, but what's really getting in the way. And then we tackle it from there.
And don't you always find that to be the case? There's always these little barriers that sometimes they feel so insignificant to the client that they don't see it. And I love that mirror of a coach, because you ask the right question and they ponder and think on it. And all of a sudden you're like, oh, it's too many people in the house. You're unmotivated. You don't ever feel like you can conquer this. There's always, I love the mirroring of coaching and just having that outside perspective to ask the right question to get us to the right answer. It's really cool. And I love that you have this, you're honed in on your specialty of diabetes, because it definitely is an area that lifestyle, like you're saying, makes such a big difference. And I feel like you mentioned that a lot of people get this diagnosis and they automatically feel defeated, and maybe because they've seen a family member not handle it very well, or a friend, or that's what they've known about diabetes. Talk on this for a second, that again, lifestyle can make a huge change. You can make a huge change. How do you hope for people when they get that diagnosis? Like if you were in that room hand holding them, how you could help them enter this a little differently?
Oh, yes, definitely. A lot of people usually don't have that, because I see them when they've gotten the diagnosis. It's usually maybe in their charts from the doctor's office, or a nurse calls them and says, "We called in something for you because your numbers are off, so you need to start this medication." That's never a nice way to start. It's something that's happened to me, definitely, where I went in for a test and they said, "Okay, test is positive. We have," actually not even that, just the pharmacy called me and said, "We have something ready for you." And I'm like, "Why?" And so they say, "Oh, because it came from this GI doctor." Oh, I did go for that test. So why didn't they tell me they have results? And I retract back to call the doctor. And they say, "Well, we sent medication to," or at least the nurse said, "we called medication to the pharmacy." And I'm thinking, could we not discuss my issue? So I could see how that happens, that someone it's not always sitting at the doctor's office. They're probably at home or going about their day. And then they have this diagnosis and it stumps them. What do I do? And it's the human reaction where they know that they're not happy and maybe they're reacting in a way. And it's just hard to come back to, okay, this is the reason I'm feeling this way and this is how I need to act. So if they knew that they had the support I would provide, yeah, they will know that they don't need to go it alone, because I know the first thing they do is individuals, maybe once they're diagnosed, the first thing I hear is, well, the doctor say to eat differently, eat better, or work out, but I don't know what to do. So we start from there. What do you know to do? Definitely what they've been eating, especially when they're leading a really, really busy lifestyle, is something that's convenient. And everything that's convenient is definitely not something they should be eating. So we go by what works for them, as in planning ahead for their meals. We go through that. I know that if they cannot cook, maybe they can have someone who can send, the meal ready-made meals that you can freeze and thaw, or if you can just have the ingredients and cook them. So we work, actually, the very first thing we do is just declutter the environment. Okay, what do we need to let go? Maybe it's in the pantry, maybe it's on your kitchen counter, and then what can come in. And they don't have to feel like they need to throw out everything. It's more, okay, now you need to eat things that are higher in fiber. So how do you do that? We learn that this is foods that are higher in fiber, which means you're going to buy more of those. And that means the rest of those other things that you don't need to take don't need to come in because they don't fit in your space anymore. So it's just hand holding them and telling them, you don't have to run and get a gym membership. It's more of, what can you do already, that will keep you going. It's, if the doctor said you need to work out, okay, workout can come out in so many ways. It's not always hit the gym for an hour every day. You could just walk your dog, listen to a podcast or a book while you're walking. That way, it's something that comes naturally versus feeling like you need to create this whole event where you need to go buy shoes and get into a gym and get ready. Like, those are things that waste your time and wear you out, and they're not motivating at all. If you just stepped out and went to the mailbox, it actually changes the whole perspective. You don't have to do all of that. So we start from there, the most simple things to do. I've not asked the clients to actually get a gym membership. They're surprised when I say, you could just sit somewhere for 10 minutes, no technology, and just breathe. And it's a whole different perspective, but it's something that we never make time for. And that's one thing that got me, because to me, it's like, okay, all this intense training I did, and all of a sudden, actually just take it more lightly than that. And it's the foundation of feeling better. And
I'm so with you on that. I feel like you can have all this deep knowledge and facts and whatnot, and then it's like, it's really the low-hanging fruit. It's drink more water. It's cut out a little bit of the sugary drinks. It's move more. Just like you said, I love your walk out to the mailbox example. Meditate. It can be fun and calming and wonderful. It doesn't have to be beat the pavement and come out all sweaty and bruised to get results. So
totally take it easy. And also I found out that that's what really makes it hard for people to grasp, because they feel like, well, I need to do that intense thing. Mm-hmm. But then once we talk about, well, but how long are you going to do it? You don't have time in your day. You have a household to run. You still got to be at work. So tell me when you're going to do all of that. Oh, yeah, I can't do it. So yeah, we're going to start really slow. Like, you just need 10 minutes.
And this again, it's what I love about the coaching aspect of it. And you are wonderful. I know that we have listeners who are going, I could really use you, or I know a family member, I would love to use you. What is the best way to connect with you?
So, outside of the pharmacy, I am on LinkedIn and also on Facebook under my name, Esther Onyoni. And I meet individuals from there. I actually do a lot of talking about different ways you can hack your diabetes. And I've gotten people who said, oh, yeah, my genes don't have to involve me worrying about having diabetes. So, yes, I do like weekly live training on Facebook. So that's where I can be found, Facebook and LinkedIn.
Wonderful. Okay. And I always like to kind of wrap up sessions in this way. If you could wrap your arms around our listeners today and tell them one last bit of like, I hope and pray that you hear this out of me today, what would that look like?
It will look like this. As much as everything goes on in terms of your daily routine that's really intense, just sitting back and breathing. Just take 10 minutes in the car, 5 minutes even in the car before you step into the house, and just be in that moment. That will change a lot, changes your outlook on a lot of things. That's what I found out, and I hope they could do that as well.
Thank you. You truly are wonderful, Esther. Thank you for joining us today.
Thank you for inviting me to your podcast. This is awesome.